Okay, thank you very much. I think Kosham can give my speech for me. She knows the topic very well. Okay. Well, to put everyone in proper context, I've been giving a lot of talks all over the world, but this is very special for me in particular because you all have made me feel like family. And it's much more difficult to talk to family than people who I don't know. Okay, so like Koshang said, we are going to talk about healing the body at the cellular level. Okay, she's right. We always deal, us specialists, we always deal with, for example, in orthopedic surgery, we deal with musculoskeletal health. The liver doctor will deal with your liver, the heart doctor will deal with your heart. But what's common among these organs is the cell. And we were born from just one cell. One half from your mom, one half from your dad. Okay, so let me start with this video. For those of you who recognize this show, you're in the right place. Okay, so show of hands, who recognizes this show? Very good. I am in the right place giving this talk. Okay, so as the caption says, better, stronger, faster. That's how we wanted ourselves to be even back in the 80s. This was late 70s, actually. Better, stronger, faster is how I deal with my patients because most of my patients in sports medicine are not really sick. They want to be better. They want to be stronger. Some of them, the athletes, they want to be faster. So what do? I was not trained for this. I was trained to give medicines for a diseased liver. I was trained to give medicine for an infection. So throughout my research, I started going back to biochem. We have a biochemist here in the audience. What makes the cell, or actually the organ or the human body, perform better, stronger, faster? It's actually taking care of each and every cell that makes up the human body. Okay? So in his book, Robert Goldman, one of the founders of A4M, the American Academy for Anti-Aging Medicine, said that sports medicine is the predecessor of anti-aging medicine, which is actually what got me into this practice. You might be wondering, what is an orthopedic surgeon doing with longevity? Okay. So in the practice of sports medicine, I see a lot of patients, among most of them are athletes. They get injured, and the challenge to me is, how do I get this athlete back into the game the soonest possible time? To tell you the truth, when I was training, medicine had nothing to offer. They had to undergo surgery the same way as everybody else. They had to undergo rehabilitation and recovery the same as everybody else. And so in the ambulatory management of sports medicine or sports injuries, ambulatory means you have to send them home right away. I was challenged to look for what I can do for these athletes, because if they don't compete, they don't live. And if they don't live, their career is over. So we had heat modalities, we had electrical stimulation, we have ultrasound and radio frequency, we had advancements in arthroscopic surgery, making it less invasive, minimalist, and getting the athlete back in their feet and back into the game. So why not introduce healing the cell into healing these athletes? So cell therapy has been practiced all over the world since the 1800s. We transfuse blood, that's the kind of cell therapy. We transfuse blood on anemic patients. Anemic patients are those with very low red blood cell count. So we give them what they need, more red blood cells. Now, our body, fortunately, they heal themselves. I'm sure you all agree with me. Like doctors will become AI in the future. The body will no longer need doctors. In fact, in my practice now, all I do is explain to patients what's happening to their bodies, so they will understand and they will do what's right for their bodies. exercise, proper diet, and supplementation. That's all your body needs, and your body will take care of itself. So we introduced all of the things that were available in our armamentarium. Cell therapy was in the heyday during then. It was starting as a result of research on stem cell therapy. We had platelet-rich plasma. I'm sure some of you have had injections here from your doctor using PRP or platelet-rich plasma. And this is nothing more than just isolating the most useful cell in the blood, which is responsible for healing, your platelets. That's why when you get a wound, when you get a bruise, when you get a laceration, it's your platelets that are migrated towards the site of injury, first of all the cells. Number one, to clot, so you don't bleed to death. And second, because they have to release all that is essential for healing to begin. And then you have your peptides. Peptides are nothing more than these substances that your platelets carry. And then I made cellular supplements the last because it is being more and more recognized nowadays as essential to helping the patient and the body heal. Okay. So in this day and age, anti-aging medicine has been nothing more than a quest or a pursuit of longevity. We all want to live longer. And as was said in the beginning of the evening, a lot of people now are living longer because of the breakthroughs in medical technology. The thing is, we don't just want to live longer, we want to enjoy our added life, our added years. So it's not just lifespan, it's also health span. We have to be healthy. In fact, when Kaoshang mentioned her dog, it really missed my dogs because we know that dogs just live a short span of lives. And then we need to enjoy them and give them that health span that they also enjoy. A few years ago, cover of Time magazine carried this baby, and it said that this baby is meant to live to 142 years old. You'll probably be surprised, but believe it or not, the human body was designed to live to 150 years thereabouts, meaning our cells are capable of dividing, repairing, regenerating, and lasting to make ourselves, our bodies, live to 150. But now the average lifespan is 75, 78 for women. So husbands, respect your wives, they will outlive you. We've halved that longevity, that lifespan, because of what? Our lifestyle. Some intentional, some not so intentional because we're exposed to them without our choosing or decision. So the pursuit of longevity actually is to chase after revisiting this actual lifespan that we were designed, that our bodies were designed to last. And even in the days of Hippocrates, the father of medicine, the body heals itself was a very well-known principle or policy. And aging, as Hippocrates would say, is a disease that you can treat, even back during the Greeks. There is everyday wear and tear, but there is also healing by the body, and it's called regeneration. So it's always a race between degeneration and regeneration, and the driver of that race car is no other than your cell. And it's the enhancement of the basic way, the way the cell was meant to function. It is the enhancement of the basic cellular physiology that we are developing more and more in the advance of medicine. So this is how a cell looks like. So it has your cytoplasm, the outer component, and each cell make up an organ, your heart, your liver, your musculoskeletal system, everything. But the thing is, the cell itself is made up of many, many parts. You have your cell membrane, you have the nucleus, which contains your chromosomes or your DNA. Now, this is already subcellular medicine, meaning in the cell, a cell will only function very well if the DNA is intact. Okay, so disease happens when your DNA gets damaged. And when your DNA gets damaged beyond repair, the cells die. And this process is called apoptosis. Okay, so this is a normal, natural cycle of life. The thing is, when your DNA gets damaged and the cell has to die, some cells refuse. And that's how you get cancer. So cancer is nothing more than a cell with a damaged DNA that refuses to die and keeps replicating without control. And that is how you get your tumors, your mass, your cysts. A cell that refuses to die when it should die because it has damaged DNA. So in order to heal the body, you heal the cell. And how do you heal the cell? You help the cell recover from a damaged DNA. This is what you call a stem cell. Okay, so it has no identity. Our bodies, all of us, have stem cells in the bone marrow and circulating around the bloodstream. Now, these stem cells are very important because this is how the body heals itself. Okay, so when you have an organ, let's say a liver, with all these cells making it up, once a liver cell gets damaged, your stem cells will migrate to the area of the liver, multiply to provide more stem cells, and differentiate into a liver cell. Okay, if this were a heart organ, your stem cells will divide and differentiate into a heart cell. So picture that as the way your body heals itself, and doctors have nothing to do with it. So my role here is to let you understand how you should take care of your body so that it can heal itself. So we talked about how the cells repair themselves at the DNA level. Now, I started taking Celergen way back because it is the only supplement that I found in my research. Imagine me researching all those years on how to make my athletes get back to the game as fast, as quickly as possible. Okay, so it was a driving force in my career, in my profession, in my practice, that I came up with Celergen. It is the only supplement that works at the DNA level. It is actually nucleotides. So if you remember that chromosome, all those links, the chain, each link is called a nucleotide. It's a molecule that makes up your chromosomes, your DNA. Now, if a DNA is damaged, it gets damaged at the nucleotide level. So one nucleotide, in genetics, we call this Gattaca. If you've seen the movie Gattaca, Gattaca is actually all the nucleotides that are involved in keeping the DNA healthy. So one letter gets destroyed, mutation happens. And a mutation is not a superpower. Okay, so Marvel Comics has it wrong. Mutation is actually when your chromosomes, your DNA gets damaged, one letter gets changed, and the way the cell functions changes. So Celergen is natural. Number one, it's from marine, which brings me to your new marketing campaign, The Ocean Within. I love it. Okay, it's a marine derived supplement, so it's natural. It's biocompatible. Why? Because it acts basically on the nucleotide, the building blocks of your DNA. It's very potent, as you will see later when we deal with the studies. Sorry, I have to go into the technicalities of scientific studies. And it's very safe, as proven over the years. Otherwise, I wouldn't be standing in front of you. Okay, so it's made up of three main components. Your bio-DNA cellular marine matrix, which is actually your nucleotides. It contains peptide E collagen and your hydro-MN peptide, which we know in medical practice, N peptide, N standing for nucleotides. Okay? Peptide is a chain of amino acids. Everything in the body, as our biochemist knows, is made up of amino acids. Short chain amino acids are peptides. Long chain amino acids are proteins. So this is where protein comes from. Okay, so when speaking of your hydro-MN peptide, it is proven to reduce the dietary glycemic index because it helps your insulin function better. Okay, so all of these happening in the cellular level will be manifested at how your organs function. How many of you are diabetics or no diabetics? Okay, diabetes happens because of a mutation in 3 locations in your DNA. Now, once a cell in your pancreas gets damaged by a mutation in these 3 locations, you develop diabetes, meaning your insulin production changes, the way your cells listen or is affected by your insulin changes. So even if you eat a lot of sugar, your insulin is not capable of controlling the rise in your blood sugar and you get spikes. And that's how you get to be a diabetic. So N-peptide is proven to reduce dietary glycemic index. How? By repairing these mutations at the sites of the cell which make you a diabetic. Okay? It aids in maintaining healthy body weight because insulin resistance is when your body not listen to your natural insulin anymore. So eventually, if you don't change your lifestyle, you end up injecting insulin to yourself. So insulin resistance is the first step that happens when you develop diabetes. It even has a name now. It's called metabolic syndrome. And your doctor tells you, oh, you're pre-diabetic, meaning your body does not listen to your insulin anymore. And eventually, it listens less and less, and your blood sugar is not controlled. So what's responsible for maintaining that when you take Celergen is your hydro-MN peptide. Peptide E-collagen, from the name itself, collagen. Collagen, as you know, is responsible for your joints, your cartilage, your skin. Okay, everything about us is collagen, the structure. Okay, so it is outed to be an anti-arthritic agent against destruction of your joint cartilage. But again, of course, you have to change your lifestyle. So with diabetes, you have to change your diet. With arthritis, you have to change your exercise or your level of activity. You get arthritis because you do not wear out your joints. You get arthritis because you don't use your joints enough. Okay? Our joints were designed to move. And when we do not move, the lubrication dries up and your cartilage starves to death. Cartilage cells, otherwise known as chondrocytes. Okay? Now, it helps prevent damage to your synovial membrane. The synovial membrane is the sac of the joint sac. And this is what contains the lubricants for your cartilage. And it's your peptide E-collagen that is very responsible for that. It also helps maintain the quality or the density of your bones. I'm sure you've heard this a lot. For those of you who know that TV show that I flashed before, you're at the right age when you are developing osteoporosis. So this is very important. You don't only need calcium, vitamin D or calcitonin, and cholecalciferol. You also need to maintain the proper quality of collagen. Okay? Okay, peptide E-collagen also reinforces skin hydration. If you have healthy collagen, okay, we look old because our collagen becomes loose or looser. Okay, that's why our skin sags. If you have good collagen, your skin does not look as aged. Now, vital to the quality of your collagen, it's hydration, meaning the water content. If your collagen is not of good quality, it will lose water faster. And with this study published not too long ago, they found that that with taking Celergen only as little as 3 months, there's 10% increase or maintenance of the water content of your collagen molecules. Okay, so if you continue losing water, your skin will look sagger and sagger, older and older. It also increases the quality of your collagen when it is well hydrated. That is why it has what we call an anti-wrinkle effect. You'd get less wrinkled when you're using this, and this is just, look at that, just on the 28th day, just a month, barely a month of taking Celergen, there's a 30% improvement in the quality of your skin on the macroscopic level. Okay, so collagen, like the rest of your skin, gets changed or worn out depending on your habit or your lifestyle on a daily basis. Okay, skin is one of the organs in the body with the fastest turnaround time. Okay, so you have to have good lifestyle, diet, activity, and nourishment or supplements to maintain a very good looking skin. Okay, now let's focus on your the guest of honor, as you would say, your bio-DNA cellular marine matrix. Okay, this is your nucleotide, and this is a study which is closer to home for me. So this studied the quality of cartilage in a joint. This is particularly your knee joint. So in 21 days, there is already an increase in your bio-DNA cellular marine complex in reduction of pain. And it surpassed other anti-arthritic drugs on the 42nd day. So they used, we have, in orthopedics, we have a scoring system. We have a lot of scoring systems which help us assess a patient's response to our intervention. And one of this is, of course, pain. So the less pain they have at the end of the study period, the more effective the intervention is. And the intervention here is nothing more than Celergen. Now, this is the effect on back pain. I'm sure all of you here, 100%, have had back pain at any time in your life, okay? In fact, in my practice, and I'm a sports medicine doctor, I don't see much of the elderly patients back then when I was starting. Most of the patients I see in the clinic are back pain patients. And we were trained to give them pain relievers. And then after a few weeks, they get relieved. After a few more weeks, they come back with the same back pain because we did not talk to them about lifestyle. We did not talk to them about how they should be more active, how they should maintain exercise so that their back pain does not recur. Now, this one is a study on 116 people with back pain, and giving Celergen not only reduced pain, their functional, mobility, and improvement of general condition all improved. Again, Celergen and your other modalities like pain analgesics or some muscle relaxants. Okay, this one is a study on people with mostly physical symptoms. So this is not even related to musculoskeletal alone, just muscular pain, 63% improvement, visual disorders, palpitations, difficulty in breathing, flatulence, your gastrointestinal system, vasomotor puffiness, dizziness or sweating. This is your autonomic nervous system, which we will talk about later again. And polyurinate, urinating very frequently. Many factors contribute to this. Either one, you don't drink enough water, so you develop UTI. Second, you have very poor bladder reflexes already, which is quite common in the elderly. This one is actually, for mental health. Again, improvement in symptoms, anxiety, mental fatigue, irrational fear, sleep disorders is what most of my patients report to me initially or early on when I put them on Celergen. memory disorders, I have actually a personal experience with this because I gave this together with NGF to my mom who was suffering from Alzheimer's a few years ago. And then sadness or pessimism also improved. This one is recovery on exercise. So this is actually, I made this graph the last because this is closer to home again. My athletes, either from surgery or from injury, both recovered faster. And this is quite a very significant difference as to those who did not take Celergen. So this is actually the reason why I came upon this supplement and why I now, until now, use it on my athletes who are either recovering from surgery or just recovering from an injury. This is a publication, a clinical publication that's, for me, very milestone because it cannot be more cellular than this. This is the effect of Celergen on liver cancer cells. This is an in vitro study, meaning it was done in the laboratory using isolated liver cancer cells and Celergen. So in this study, they observed the proliferation of the cancer cells. And as we know, these cancer cells proliferate by the hour. This graph shows a 73% reduction of the multiplication of your cancer cells or the propagation of your cancer cells in 200 days. This graph shows an increase by 30% of apoptosis. So cancer cells, again, like I mentioned earlier, are cells which are supposed to die, but they don't refuse to die. Giving them Celergen or the biomolecular matrix, it increases 30% of these cells who refuse to die. Okay, 30% is a very significant number when you're treating cancer. Okay, P21 gene expression. This is a particular gene that is found in cancer cells. They're supposed to be active, but they are not. So this is one of the genes, together with your GAD153. These are two genes that cancer cells suppress. That's why they don't die. Okay, so there is a 4 times increase in your P21 protein and a 12 times increase in your GAD153 when these liver cancer cells were exposed to Celergen. And this is just within 48 hours. And the gene which was identified in almost all cancer cells, your CMYC, this study showed a 40% reduction in your cancer cells or gene expression of the CMYC. Now, why is this important? This study just involved liver cancer cells, but CMYC can be seen in all these cancers and more. Okay, so if you can control, number one, the proliferation of cancer cells, if you can stimulate or re-stimulate or reactivate the genes that are supposed to control cancer and kill or suppress the gene that causes cancer, then you are on a very good path or route to treating cancer, or at least preventing its progress. So that's why I call this a milestone study. So that is your DNA, and that is where Celergen acts. A damaged DNA leads to disease. A damaged DNA leads to a cell or gives birth to a cell that does not die or refuses to die. And your nucleotides, each bridge here is a nucleotide, okay? These are all repaired by giving your bodies the supplement that it needs to do so. Okay? Any questions? We'll save the questions to the end. Yeah. So this brings me to another supplement that has been very near to my heart, like I mentioned earlier, because I used it on my mother. So this is a supplement which helps specifically your nerve cells to regenerate. So again, it helps your body to heal itself. Why do we have so much Alzheimer's nowadays? Because one of the drugs that we doctors give to our patients has a side effect of causing neurons not to repair themselves. I will not mention the drug, I will not mention the effect, but I'm sure you know what I'm talking about. Okay? So these neurons are the slowest cells in the body to regenerate and repair. So one small side effect that prevents their repair has a very monumental effect on the human body. And this is manifest in most patients as early onset dementia, otherwise known as Alzheimer's. Okay? We expect dementia in the clinics at around 75 or 80 even. You start having difficulty focusing, okay? Take note, focusing and not remembering. It is not a memory problem. It is not a memory issue. It is actually a difficulty of recalling the name of the person in front of you because you cannot focus as much as you were when you were 10 years, 20 years younger. So I don't want my patients, I correct them when they tell me, doctor, what can I do for my memory? So I correct them, it is not a memory problem. It is a focus problem because what is affected when we age is the interconnection of your nerve cells. That's what we lose. So when you don't have so thank goodness for supplements. Supplemental microphone. So we are said to have 100 billion or so neurons. So 100 billion is a big number. So what if one or two dies? It should not be significant, but unfortunately it is very significant because all of these neurons have their own assigned function. 1 or 2, 3, 4, 5 neurons as a group, they're in charge of how you sweat when it gets too hot to lower your body temperature. 1, 2, 3, or 4 neurons are in charge of how your estrogen is produced by your ovaries. So that specific assignment, all our neurons have. So when 1 or 2 of these 4 or 5 neurons die, then that function is greatly affected. And how much more is this manifested than in your autonomic nervous system? Your autonomic nervous system, as the name implies, it's autonomous. We don't waste brain power thinking of, oh, I should sweat because it's 38 degrees out. Oh, my muscles should tense up because I'm going to fall down the stairs. These are automatic functions of your nervous system that is most of the time the ones that manifest damage. So I'm sure a lot of you have experienced, my legs are warm suddenly, or my legs are cold suddenly, because your body has failed to correct the temperature as you are exposed to the environment. And that is a problem, or a function rather, of your autonomic nervous system. And you have two limbs of your autonomic nervous system. You have your sympathetic, your fight, flight, or freeze response. And you have your parasympathetic, the limb of your autonomic nervous system, which brings everything back when the threat of stress dissipates. Your homeostatic limb, what brings your body to homeostasis or balance. Okay? So all of the systems in your body are governed by this autonomic nervous system without you having to think of how it should function. And that is why we even have tests that focus on the autonomic nervous system. So to tell us and help us manage how a patient is being affected by nervous system disease or nervous system degeneration. So again, it is a race between degeneration and regeneration. Now, similar to how the platelet heals any injury in the human body, in the brain, we have a substance that helps the body regenerate. It's the NGF, or neural growth factor. Okay, the NGF, as you know in this room, is natural growth factor. Okay, but this one is actually what is produced naturally in your body. As you will learn in your research, supplements are nothing more than substances that you add to top up what your body naturally produces. And that is how I wish and I dream that doctors would heal all their patients. They will just help the body heal itself. Okay, so NGF is actually discovered or was discovered when they were studying why people or cultures that eat a lot of bird's nest soup have later dementia. Okay, so these are actually the blue zones. And some parts of the world have this as a regular staple in their diet. It's not the nest. As you know, the nest is made up of twigs. So it's not the bird's saliva which combines or builds or cements the twigs together for a nest. It's actually the fungi or the fungus that grows on that saliva that helps contains more of this neural growth factor. Okay, so I heard a lot of AS. Yes, it's a very common misconception even among doctors. They don't know where it came from. But suffice it to know that it actually is a natural thing that natural substance that your brain produces to help your brain regenerate and repair itself. So what does NGF or natural growth factor or natural NGF contain? It has, number one, the NGF. And this is, among my research, the highest concentration of NGF in any supplement at present or currently available. So it helps stimulate the production of nerve growth factors. Okay, so it does not just act on your nerve cells, it also helps your nerve cells to generate more substances to help regenerate your nerves. You see the cycle? So very similar to how your cells, your stem cells, naturally specialize to a particular organ that is injured, this one actually induces your nerve to repair itself in the beginning. Okay, it has also purple chokeberry. It is known to improve the body's own natural production of insulin, so it also helps in your metabolic syndrome. It is also anti-inflammatory and a natural cancer fighter or an antioxidant. Okay, sorry if I have to simplify some of the terms, but this is so that we do not misunderstand or misinterpret anything. Okay, Bacopa extract is a memory improvement herb. Okay, it also protects against brain aging and dementia. And it's an anti-anxiety and antidepressant because it contains a lot of the amino acid tryptophan. Tryptophan is your building block or the basic substance that you need to produce more serotonin. Okay, we're all familiar with serotonin being the feel-good hormone. Most of the people with dementia or with brain damage, they secrete less and less and less of serotonin. But unknown to a lot of people, even doctors, serotonin is really very limited in terms of production. That's why I don't want to ask who of you here are taking antidepressants, but suffice it to say that antidepressants are mostly what we call SSRIs, selective serotonin reuptake inhibitors. Serotonin is reuptaken after it is used by a nerve cell to activate the next nerve cell, and it is reuptaken to regulate and save it. SSRIs or antidepressants, what they do is they inhibit or they don't let your nerve cells reuse serotonin, so you end up losing serotonin. That is why antidepressants, after a year of taking them regularly, they lose their effect because you don't have any serotonin anymore. Now, back to the discussion. The Bacopa extract is found to contain a lot of tryptophan, which is the building block for your serotonin. So most of my psychiatric colleagues, they use this to replenish the body's supply of serotonin using tryptophan as the main ingredient. It's also a blood pressure regulator because it contains a lot of folic acid, which is a vitamin B complex. For some of you, we don't probably know that the folic acid is actually vitamin B9. It is part of the B complex set of vitamins. It contains sage extract, which boosts cognitive development. We talked about the interconnection between nerve cells. That is basically responsible for your cognitive development, how you learn things. So when we learn new things, these interconnections are rebuilt or are renewed. Okay, so that's why they say that the best way to ward off dementia or Alzheimer's is to learn something new every time. Learn a new language, learn to play a new instrument, etc., and etc. So this also has the advantage of lowering your blood glucose, again, about metabolism, and it is beneficial in your gastrointestinal tract. Nattokinase, we know this, prevents heart attack and stroke because it lowers your cholesterol naturally. It reduces blood clotting in the vascular system, and it helps improve your blood circulation. And beta-glucan, it strengthens the immune system. This is actually something that we get less and less as the generations develop or happen, because most of us are being recognized to be gluten sensitive, and beta-glucan is a very important component of gluten. So when we avoid gluten, we are deficient in beta-glucan. This is why it is also important that you take it as a supplement. It helps with your metabolism as well, and thereby ultimately lowering the risk for obesity. Okay, so this is just a slide which considers why taking bird's nest naturally versus as a capsule. There's the issue of hygiene, there's the issue of processing it very consistently, the risk of infections, of course, and the risk of contaminants, particularly heavy metals. This study was actually launched here in Singapore. This was by Professor Lee Kameng, a very good friend of mine. And this is when they launched the importance of NGF as a neural growth factor and as a help against preventing the development and progression even of dementia. So they analyzed cell numbers, particularly of the neural system, and found that this is bird's nest. So green and red is actually where you have increase in your cell numbers, as opposed to or as compared to your natural growth factors naturally circulating in the blood. So they increased the natural production of your growth factors just by giving them the bird's nest extract. Okay, so these are your nerve cells. So imagine getting less and less of those interconnections between your axons and your neurons. So these are the interconnections that you lose when you develop dementia. And when you lose or develop dementia early on in your life, this is what we call Alzheimer's. I'm just saying it this way because a lot of my patients tell me, or they complain about their parents being demented, and the parent is already 90 years old. That's expected. But if you get that kind of condition when the parent is just 70, 75, then that is early onset dementia, or too early to expect. Okay, so what do we do with all this knowledge now? So unfortunately, supplements will not save us. Okay, we are already in that part of our lives when we've done a lot of damage and degeneration has already overtaken regeneration. But it's never too late to change your lifestyle. So with these supplements, if you expect these supplements to work the best that they can for anyone you hold dear to yourselves or even yourselves, you have to modify your lifestyle. So let me ask you, who among you exercise regularly? Good. I am in the right place. Okay. Regularly means consistently, okay? When you ask a doctor, how regular should I exercise, doctor? We were trained to say 3 to 4 times a day. A week rather. 3 to 4 times a week. Sorry. That's my dream also. So 3 to 4 times a week is regular exercise. But tell the truth, from my research, it's always best to exercise on a daily basis. Okay? We are all creatures of habit. Our bodies adjust, adapt, and change to what we do to it. That's why Olympians exist. Olympians are not born. They train every day, most of their lives, so that they could win that gold in the next Olympics. Now, I'm not asking you to train every day to win a gold in the next Olympics. I'm just telling you that our bodies can be trained no matter how old you are. Okay? The thing is, the caveat with recommending daily exercise is that it has to be mild enough or acceptable enough, not only to your attitude or your schedule, but also to your own body. It has to be mild or conducive enough that you can do it on a daily basis. So for those who give everything on one gym day, they're so sore the following day that they cannot exercise. So doesn't have to be that way. Okay? So regular exercise is best done every day. If you want to nominate a rest day, then that's just one day in a week, maybe a Sunday. But it's always best, studies even show that it's best to exercise daily. So what exercise are we talking about? 30 minutes on the stationary bike or the treadmill or the elliptical, and another 30 days doing resistance exercises. What are resistance exercises? Weightlifting. It doesn't have to be a weight. It can be your body weight. So for the men or even the women, push-ups would be a good body weight exercise, and that's a good resistance exercise. So reserve 30 minutes to 60 minutes in your day wherein you do nothing else but move your body on a very consistent basis. And that is exercise enough. Okay, so if you want to imagine how good that is, just think of yourself now when you don't exercise. You're just sitting, you go to the office, you go home tired, and you never really moved. Okay, so that's how different it can have an effect on your body. So that's exercise. And I'm glad to see most of you raise your hands. I hope that's true. Who believes he or she eats a well-balanced diet? Very good again. In my career, I now believe there is no such thing as a well-balanced diet, even if we try. Why? Because, okay, we were talking about supplements. Supplements are nothing more than these substances that we supposed to get from our diet, right? But from how we eat, the quality of food that we have now, and all the exposure that we have on the toxic side, these nutrients are never enough. So I've started to believe there's no such thing as a well-balanced diet, and that is why I have become a staunch advocate for supplementing. There was a time in my life my kids called me an astronaut because I ate more pills than food. But that is in the endeavor, the pursuit, to be able to supply everything that my body needs to heal itself. And true enough, it paid off. At this point in my life, I was able to identify which my body needs, which nutrients my body needs, which I can never get from whatever I eat. And I'm sure it's a trial and error thing, and I'm sure you will be able to do so as well. Okay? And lastly, so now we call it a well-curated diet, okay? And again, lastly, supplementation. Okay, I'm sure all of you supplement, that's why you're here. And we can start with the two most known to have an effect on what our body experiencing at this stage in our lives. There's Celergen for your nucleotides, and there's NGF for your neural growth factor. Okay, we can start with that. And then you can search and pursue and try whatever supplements that your body will need. I, for one, take Celergen in the morning, NGF at night, but I also take vitamin C, D, which is an anti-inflammatory, E, F for folic acid, and I'm okay with that. Thing is, when I start losing, when I run out of Celergen, that's when I feel that, yeah, my body really needed it. So that is how it's quite unnerving or dishonorable, even for lack of better term, to tell you that the practice of medicine is really trial and error, because not any two of you are perfectly the same. So if when I deal with one of you, I have to deal with the other in a separate, totally separate way, a totally different way. And then when you do not respond, then I failed. We try another thing. And that's why I say medicine is really a practice of trial and error. But I'm sure, and what I'm very thankful for, is that a lot of my patients, and I'm sure including you, you are very conscious about your health, number one. Second, you search the internet for things, okay? Just don't be too believing. If there's a medicine is also not only trial and error, it's also a practice of logic. If it doesn't make sense, then it's not true. It has to be logical to begin with. So in correcting, I didn't want to use the word, but in improving rather your exercise, your body's activity, your diet, and the kind of supplementation that you get, you are headed for health and wellness. Wellness being, by definition, the absence of disease. Okay? Wellness is not feeling good because you went to the spa. And this is very timely because, as mentioned earlier, our human body, the human body is expected to live longer and longer because of medical technology. And based on the statistics, the number of 100-year-olds, the number of centenarians, okay, will increase by tenfold over the next 35 years. This was actually the statistics that was pre-pandemic, but still applicable now. So we are already in that 35 years. So I leave you with this video. Again, I started with a video. I will leave you with this video.
What will your last 10 years look like? Will you be quick enough for a game of tag with your grandchild? Strong enough to embrace every moment? Will you grow old with vitality? Or get old with disease? It's time to decide.
Okay, so I'm sorry about the overlapping text. That's supposed to come out now. So let food be thy medicine and medicine be thy food. That's what Hippocrates said. But it's also Hippocrates who said that everything in excess is opposed to nature. It's all about balance. Okay? So I leave you with that. I placed my email address in case you have questions that will come up in the future. And thank you very much.
Thank you. Thank you, Dr. Ben. Can I invite you to stay on stage because we have our Q&A sessions and exercising.
I am exercising.
Okay, so I've heard so much about you from DP Thingy, that how good. Today is my first time listening to Dr. Ben. It's really fantastic. You put a very complicated knowledge into very simple terms, and it's so easy to understand. So thank you very much. And now we open for Q&A. We do have limited time, so if you have questions, you might want to raise your hand now because not everybody get to ask their questions. Okay, so from Zoom, we have the first one is for NGF. Because you mentioned that one of the ingredients actually reduce blood sugar and blood pressure. So the question is how to advise intake, especially for patients who are already taking maintenance medicine, as they may suddenly have hypertension or dip in blood sugar. And when that happens, doctor will say, oh, don't take supplements.
Well, the dose of these supplements are actually what we call empiric, meaning they're not hard and fast dosaging, which is actually true because these substances do not exert as much effect as to lower your blood pressure that low. Okay? So, in other words, if you're taking antihypertensives, it will not cause your blood pressure to drop lower. So what these supplements are designed to do, designed by nature, not by any pharmaceutical company, what these supplements are designed to do is just to bring the body back to natural or normal functionality or functioning. That's why we stated in one of the slides, enhancing cellular physiology. The body regulates itself. It will never, if you're taking these supplements, never bring your blood pressure back down lower than it's supposed to be. If it goes down lower, then there must be something that you are doing. You're probably, your present antihypertensive may be too strong for you already. Your blood sugar medicine should be also checked, because when you improve your diet and your sugar level goes down, your sugar spikes are prevented, then your blood sugar medication may not be needed anymore. Remember, diabetes is reversible, as is any other disease to a certain degree. So if your blood sugar goes down below normal, then you have to look at something, not your supplements. I hope I answered that question.
Yeah, definitely. Yeah. And we do have a lot of our customers that have this kind of effects that they are able to lower their medications. So I think that's a blessing. Any questions from the okay?
Thank you for your explanation.
Thank
Since Celergen is about cell repair, does it repair all organs, including the reproductive system?
Yes, it does. To a certain degree again. Okay, if you're asking me if it will bring back your menstruation, no, it will not.
It's not about bringing back my menstruation, but for someone who is like active, but let's say the womb is damaged or ovary damaged, blocked or whatever, does
Okay.
it help? Yeah.
I get it. I was just kidding with the comment earlier. Okay. One of the things that we observe when you start repairing your cells or your body at a cellular level is that all the normal functioning is brought back. Okay, not back to a younger year, but back to how it should be. We are all aging ahead of our time, all of us. Like you saw in the Time magazine cover, we are meant to live to 150 years old. We only live to 75. Okay, so we are all aging ahead of time. So what the body aims to do is just bring us back. And these supplements are no more than helping the body function properly. To put the reproductive system in particular, most of us age because our hormones are lower than they should be. Okay? But what's more accurate is we age because our hormones decline, not the other way around. Meaning, we lose our menstruation, going back to that initial example. We lose our menstruation when we enter menopause at around age 55, when we should be entering menopause at 85. Okay? When we're meant to live to 150, menopause should not happen until 85. So when we take supplements, when we attempt to repair our bodies, it will just go back to that normal balance between estrogen and progesterone, and estrogen, progesterone, and testosterone. Okay, this will be another discussion, so I will not delve too deep into it. But these hormones, including what we call neurotransmitters, if you're familiar with the term, neurotransmitters are hormones in the brain, produced by the brain. Hormones and neurotransmitters are chemical substances that the body uses to communicate to each other, the organs and the cells. So everything that happens in the body is practically chemical. So if you get a disease, if you get enter another stage in your life, which is menopause, it's because chemicals are changing. And these chemicals are particularly hormones. Now, if you get menopause earlier on than you're supposed to, supplements or trying to attempt to heal the body or bring it back to normal will also help when you take supplements. Did I answer your question? Doesn't seem like it. Well, if your body can, like I said, to a certain degree, if the damage is too advanced, then it will not be repaired back to normal 100%. Maybe I can explain that from an experience I had with a few patients. I have patients who ask me if taking Celergen, for example, or any supplement for that matter, will help their end-stage renal disease. And these are patients with, if you're familiar with the GFR or glomerular filtration rate, if your GFR is 15% or lower, then your creatinine will start rising. And you will need dialysis to clear creatinine, which is a byproduct of your metabolism. A buildup of creatinine is not good for the body. It's actually poison. That's why you need to go to dialysis. Now, I have patients who ask me, will Celergen help me? And I said, yes, if you take Celergen and notice that your GFR is improving, then it is helping you. Meaning your kidneys are regenerating themselves enough. And true enough, most of these patients who are undergoing 3 dialysis in a week, they go down to 2 dialysis in a week, 1 dialysis in a week, and their GFRs improve from 15% to 30, 35%. But this is the happy, these are the stories with happy endings. There are also patients, I hate to admit, who do not respond as well. But that should answer your question in a way that if this will help some people, then it should be helping a lot more if they take it. So that's how damage is repaired to a certain degree. Because without taking anything, your body actually strives to repair itself. How much more when you try to help it with supplements that it needs to do so further? I can see that you have a follow-up question. Please, I don't want you to leave without... No, one more from you.
Okay, I have a colleague who has got visual problem. I noticed just now in your slide that it helps with visual problem, but he was saying that it's more about what's that? Iris or what? The light intensity doesn't go in. And he asked the specialist said, no, nothing can be done.
You're talking about cataract, I suppose.
Not cataract. He didn't say it's cataract. It's just that he says that I don't think it's cataract. It's the
his vision is down to light perception, you mean?
Yeah, something like
Okay,
that.
so these are terms that we use in the clinic. So when your vision is down to light perception, that means you can see the light, so your eyes are functioning to a certain degree, but you cannot recognize people, for example, because you cannot see the details anymore. And furthermore, you cannot actually read. The eye as an organ can also improve because all these effects, losing your vision, these are all degenerative conditions. So if your body is still capable of maybe regenerating your retina, if it's a retinal problem, the retina is the back part of the eye which actually sees, and it is actually an extension of your brain. Okay, so very early on in med school, we were taught that the retina is an extension of the brain. Okay, as much as your nerves and your fingers are an extension of your brain through the spinal cord. So the retina is actually a series of neurons. So taking NGF in particular can probably help improve the retina function. But I would not probably dare to say that it can improve to 100%. Yeah, but saying or telling a patient that there's nothing that can be done is totally inaccurate. I stopped saying that and I get mad at my colleagues for saying that. Because the body will always try to heal itself, whether you like it or not.
I really like that term. The body will always heal itself. Okay, another question from Zoom. What is the difference between stem cell infusion and consuming Celergen in terms of cellular repair? And how fast is the body's response between stem cell infusion and Celergen for repair?
Well, if you can do both, all the best. Okay, stem cells, as far as all your cells in the body are concerned, they run out. And even your stem cells, which we call the backup cells of the body, meaning as you saw in the video, your stem cells migrate to parts of your body which need to be repaired. Again, a chemical equation, meaning an injured part of your body will release signals chemically, which will tell your bone marrow to release stem cells. And these stem cells will follow that signal to the area of injury. Okay, so how does stem cell infusion work? Because you renew your supply of stem cells. And more than that, if your stem cell is from an allogenic source or origin, meaning from another person, and most of these people are who donate stem cells are younger, then the faster your repair will be because you are using younger stem cells. Okay, as we age, our stem cells also age, so they are not as capable of that. And studies show now that if you use stem cell infusion, the younger stem cells will reprogram. I don't know if I included that in one of the slides. Will reprogram your older stem cells to act better. Okay, reprogram. Again, a DNA equation. So taking stem cell infusion and Celergen, which will repair your DNA, will work synergistically or multiplicatively, not additively. I hope I answered that question. Yeah.
Yes, it's not my question.
Okay.
Hi, Dr. Ben. Thank you very much for insightful sharing. I have a question that often come across with regard to dementia and NGF. Is dementia designed towards more like preventive, to help our brain cells avoid coming towards dementia so quickly? Or can it also help someone who is already advanced in dementia? Is there a reverse, how should I say, benefit or effect of NGF? Thank you.
Very good question. Okay. Dementia is a function of degeneration. Your brains lose their interconnection. Your nerve cells actually die. Stem cells can also transform into nerve cells. But again, that part of your body's ability to repair itself is limited. Okay. Asking if it will reverse is possible. Yes, it's possible to reverse, but the least we expect is to halt the progression. Meaning it's allowing your body to catch up. Again, the body will heal itself no matter what. So even if you do not take anything, your body is trying to replace your dead neurons, develop the interconnections again. And how much more if you take something to help it do so? Okay, so the least expectation is to halt the progression. If you observe that the progression is not being halted, then there must be something that you have to take closer look on or closer look at. Maybe there's something that's pushing the progression besides or despite rather your efforts to help the body heal itself. So the least expectation is to halt the progression, and I wouldn't be surprised if it reverses a little bit, because that happened to my mother. She was already at that stage of dementia wherein she couldn't even recognize me. She thought that I was her father-in-law because I do look like my grandfather. But I did not exist. But when she improved, partly NGF, partly hyperbaric oxygen therapy. So again, not one modality will really address the issue. She started looking at me in the eye and saying my name.
Oh.
So it's I'm still having goosebumps now, but well, she passed on during the pandemic, so she's in a better place now. So expect at least a halting or a delay in the progression.
Okay, physical, you all need to catch up because Zoom has quite a lot of questions. Okay, I think this is a doctor. I see patients post-op. So do you have a specific regime for Celergen? Say how long, etc., to optimize its effect? Post-operation.
Post-operatively.
Yeah.
Okay, the one of the basic reasons why I started prescribing Celergen to my athlete patients is to help them recover faster for both injury and my procedures, my surgeries on them. ACL reconstructions, for example, rotator cuff tears. So my regimen is just to put them on Celergen as soon as I can. If they are not on Celergen, the first time they see me in the clinic, I diagnose that they have an ACL tear, which will 100% end up in surgery. I already start them on Celergen. They already recommend it. Because not only will that help prepare the body for the surgery itself, it will help them recover faster from the procedure. So I just put them on Celergen, nothing more than the usual dose, 1 to 2 soft gels per day. And again, we recommend 2 soft gels more than the usual one when the patient is sick or ill. And an injury is actually an illness also. And then I keep them as long as I can.
Okay, any physical, okay. I think we fair lah.
Hi, Dr. Ben. Thanks for the insightful talk. Now, I hear a lot of cell therapies supplements that's based off placenta. Right? What's your views and opinion of that?
Okay. Yeah, but thank you for that. It puts into fore one of the discussions we were having very often now. Number one, supplements out in the market that tend to overpromise. And unfortunately, if I may tag them, it's mostly these supplements that are marketed as placental stem cells. Okay, number one, it cannot be stem cells when you ingest it. When it comes in pills, it's not stem cells because cells have to be live. Okay. Two, what you actually get from these products are growth factors. And again, if you ingest them as growth factors, meaning proteins, all the substances that have to act in the body are actually proteins. They get digested and broken down to peptides or even amino acids. And when they get broken down, the body sometimes or most of the time doesn't even know that it's for that purpose that you're taking them. So it's best to take a supplement that is designed to perform a particular function. For example, I did not mention this earlier in my talk, but nucleotides are always recognized by the body as something for the DNA repair. So if you take nucleotides rather than maybe, well, it doesn't exist, but if you take whole DNAs, the nucleotide will act better because it's recognized by the body for DNA repair. So you have to take building blocks rather than exact proteins. Another good example would be collagen. There are two very common forms of collagen now. It's collagen hydrolysates and collagen peptides. If you take collagen hydrolysate, that's practically the whole collagen molecule. Your body, your stomach breaks it down. And again, your body will not have an idea of what it was taken for. But if you take collagen peptides, the body will recognize, oh, this combination of short chain amino acids is practically for repairing your cartilage. Then it will act better also.
Okay, so another question. What steps should one consider if despite taking regular supplements, for example, like Celergen, continue to experience pain or health issues?
There must be something that you have to look at again. For example, I hope it helps when I use examples to answer those questions. Number one, low back pain. Okay, as you saw in the studies on Celergen, one of the immediate effects of taking this supplement is good sleep. And then most of the regular pains that they wake up with are gone. Okay, because 85% of low back pain is practically muscle strain. Okay, muscle strain happens on a daily basis. You strain your muscle. That means you tear some of the muscle fibers. If you remember your grade school anatomy, muscles are made of fibers, and you tear that, and that is what we call muscle strain on a daily basis. Now, when you sleep, your body should be repairing those muscle tears, those strands of muscle that were torn. If you do not have the resources to repair your body or particularly your muscles, then you won't repair these muscles as they tear on a daily basis, and you carry on these tears one on top of the other every day, and you develop chronic back pain. Okay, another cause of back pain is disc degeneration or disc disease when you have an herniated intervertebral disc. I'm not sure if you all know that the spine is a series of bones, one on top of the other, and between these bones are your discs. Okay, they're what allows us to move very flexibly if we exercise regularly. So these discs sometimes degenerate faster than they should. And when these discs degenerate like any other part of the body, they emit toxic substances we call inflammatory mediators. And since 85% of back pains are muscles, the other 15% is actually degenerative disc disease. So if by taking Celergen, some of the pain disappears, but there's still some remaining, then next step would be an MRI to check your discs. But disc degeneration can also be benefited by taking Celergen or any supplement related to such.
Thank you, Dr. Ben. We have a question back there.
Thank you, Dr. Ben. I'm Thomas. I have one request and two questions actually.
Don't request Mr. Dance, okay?
I'm enlightened by your presentation in this seminar. I only wish that it could be longer. And My request is, would you be sharing the presentation with us so that, when we get home, we can do some revision?
Okay, I'll do you one better than that. You notice that my slides carried citations of studies. I also have copies of those citations, so of those studies. So if you want them, I can send them to you. I will probably, yes, actually, that's what I was about to say. I would probably allow the company to send to anybody who asks for them.
Thank you so much. And here comes my,
These are not patented by me. I just saw these things on the internet. I'm kidding. No,
Thank you so much.
Seriously, I did not do these studies, so it's selfish of me not to share them.
Thank you. And I've been, thinking a lot. I'm taking Celergen. As you know, I'm not very old in taking Celergen, just a couple of months. You in your studies and in your research, would you also look into the pharmacokinetics of it? Like, for example, in the perspective of the ADME, and then from that perspective, because I've also been asking around about the dosage. So the recommended dosage is 1 time in the morning, empty stomach. But I've also heard some advice that, for certain patients or for certain customers, that maybe should take 2 instead of 1. So from that perspective, how do we then be able in the position to kind of tell our customers or advise our customers what is the right dosage? Because at the end of the day, we are not medically trained. So, if you want to promote something, first you have to know what you're promoting. Yeah.
Thank you.
Thank you.
Okay, very good question again. Like I mentioned earlier, supplements are meant to be given empirically. So there's no hard and fast dosage. Supplements are nothing more than what you should be getting in your daily diet. Thing is, what sets Celergen apart is that it's so specific that it's nucleotides. So you don't really get that anywhere from the diet. So, but still, it doesn't negate the fact that it is a supplement. So the dosage is empirically. Now, when you talk about pharmacokinetics, that deals with how the substance is metabolized, particularly by the liver because you ingest it, and how long it stays in your body to exert its effect. Okay, pharmacokinetically, Celergen stays in your body for 72 to 78 hours. So there's still some, so even if you miss it for 3 days, you should not feel weaker, so to speak. But don't let that happen. Like I said, the experience of missing out is worse than not starting at all. Okay, so pharmacokinetics aside, the dose is basically empiric. True, the recommendation is 1 soft gel 30 minutes before breakfast. Now, why do we say that? Because you don't need food to absorb all the contents of Celergen. We only recommend taking vitamins with food if it is what we call fat soluble. And these are just 4 vitamins commonly, A, D, E, and K. These are vitamins that are digested with the help of your biliary system and is eliminated in your stool. All the rest are eliminated in your urine, which is also one of the anecdotal factors why Celergen is very effective in people with end-stage renal failure, because it goes through the kidneys many, many times with each pump of the heart even. So if you are sick, you can double dose. That means your body needs more. Okay, that's part of the empiric philosophy. So if you are sick, your body is trying to repair more, trying to recover more, so you can double your dose. In fact, you can safely triple it. So if you really want to recover quick from surgery, from an illness, you can double or triple your dose. And studies show that even quadrupling it is safe enough. Because being water-soluble vitamins or supplements, as long as you have normal kidney function, your body will just safely eliminate it if your body doesn't need it. but we are more deficient rather than in excess as far as micronutrients are concerned. I hope I was able to answer your question.
Okay, another from Zoom. I do have diabetes. Does eating supplements clashes with the jab and medicine that I'm eating? If no, what are the indicators that it's clashing?
Okay. Let me start by saying that diabetes is a reversible disease. Okay, but of course, this impacts more on how advanced your diabetes is. But we have patients in the clinic who are already on insulin, and we are able to wean them off insulin and entice the body to produce natural insulin again. But the diet has to be very strict. Okay, it does not conflict with oral hypoglycemics or the anti-diabetic meds because it helps the insulin function better, which is the same function for the same purpose as your oral hypoglycemics. So if any interaction is to occur between Celergen, which is practically a supplement, which should not expectedly interact with any substance that you take, if at all, it helps your diabetes medicines. So much so that if you control your diet, you take supplements, you take Celergen, and even NGF for that matter, because it also impacts your metabolism, your endocrinologist will have no choice but to lessen and lessen and lessen your diabetic meds. And I've seen this happen over 2 decades already. Yeah. Unfortunately, the way we manage, in reverence to the endocrinologists, the way we manage diabetes now is you don't control the blood sugar of the patient, you add one more med. You don't, the patient comes in 2 months down the line, blood sugar is still up, you give another med until the patient already has 3 or 4 medications, and your last resort is insulin. But it does not really treat the patient. It just lowers his blood sugar. That's why patients who are even controlled with their blood sugar on 3 or 4 or 5 meds for diabetes, they still end up with renal failure. So that's just in addition to the answer. So please, when you talk to your diabetic customers or clients, lifestyle modification is much, much more important than supplements. Supplements will really make it easier for them to heal, but they have to correct their diet, which is actually what made them sick in the first place.
Okay, for a last question first from Zoom. For a normal person, how long does one have to take Celergen to notice any significant improvement?
Well, it depends on the current health status of the patient. If the patient's not really sick, you won't really notice any change. But I'm not saying that you wait until the person gets sick, okay, before you recommend Celergen. Celergen, as the gentleman said, is a preventive supplement, meaning it helps your body repair itself before it manifests any disease. So I can only answer that from experience. Okay, for most of my patients, I have patients who feel better in a few days' time. Okay, I practically have a patient in mind, one patient in mind. He's a pilot, a commercial airline pilot, and he struggles to be able to go on duty every cycle. And we started taking Celergen. It made him easier to get up in the morning for the next duty. And that's because he is not repairing enough when he sleeps, but he's repairing more now because supplementing his repair. So it can be as early as a few days, or it can be as late, from my experience, a couple of weeks.
Okay.
So don't fret or don't be disappointed if you don't feel anything within 2 weeks' time.
Okay, thank you, Dr. Ben. 2 more questions, that's all.
Yeah, hi doc. I just want to ask if I can recommend to my nephew who's having a skin psoriasis because he's taking a Novartis shot every month. So can I recommend Celergen?
Okay. First and foremost, you have to determine what causes the breakout in psoriasis. Psoriasis is an autoimmune disease. So there must be something that's triggering his immune system to overreact. Okay. autoimmune disease is nothing more than an overreaction of our immune system, and something is triggering it. So first determine what is triggering it. It could be an exposure to something, even laundry soap. So if you're washing his laundry with a particular soap, you might want to change that. Bath soaps. And more common in my experience is something that he takes as food on a regular basis. This has something to do with what you probably have encountered called food sensitivity or food intolerance. So food sensitivities and food intolerance manifest 90% of the time through skin breakouts. Yeah. So determine that first, the cause. If you eliminate it, then the recovery and the maintenance of the good function of the immune system can be helped by Celergen. So yes, the answer is you can recommend Celergen to your nephew, but do not expect anything to change unless you determine what's causing the trigger, or what's triggering the outbreaks.
Hi, I'm Lily Chua. I'm interested in you saying that diabetes is reversible. Okay, in 2022, I got a cancer, and then because the cancer drugs is heavy, I mean dosage, and then my pancreas failed. So I become diabetes type 1. So is it reversible? Because it's not genetic for me.
Yes, that's actually that. You answered your question. Since it's not genetic, there's always a chance that you will able to bring it back. Because your DNA, as we always hear it being said, as the blueprint of your cells, your DNA does not change. It's not changed by chemotherapy even. So your DNA of your body, even your pancreatic cells, knows or will remember that it is not a type, you're not a type 1 diabetic. They are capable. Type 1 diabetes, for everyone's benefit, type 1 diabetes is when you are born without the capacity to produce insulin. You don't have your beta Langhans cells in the pancreas. Since you are not born with type 1 diabetes, meaning you were born with the capacity to produce insulin, your body will always remember. Now, it depends on how bad the damage to your pancreas is, but I'm sure it's not that bad that not a few cells have been retained. No.
But the doctor told me, say, I become type 1, so is irreversible. Because my drugs is Keytruda, so she say it's irreversible.
Yes, but I wouldn't agree with your doctor. Sorry. It's always not good to tell a patient that there's no cure or no healing for you, because you were originally not that. You acquired it. That's the term I was groping for. You acquired this condition, and I'm sure you're not even over 70 or 60. Your body will always repair itself. Now, if your next question is what do you have to do to bring your body to remember that you are capable of producing insulin, number one, I don't know how bad the damage to your pancreas is, but you're still alive, so it's not that bad. So what I can hazard to recommend is, of course, number one, fix your diet. So stay away from simple carbohydrates, which is a challenge to your pancreas to produce insulin. Second, I'm sure you're on insulin right now. So observe your dose. If your dose is not going up, then that reiterates my belief that you will recover. And then third, what we often overlook, but is very essential in the healing of the body, is physical activity. So I would recommend you start on an exercise program, even though a light one at first. But what benefits the body from physical activity or regular physical activity is the consistency. So it will work if you do it consistently, even if it's very, very light. Like my example, walking, stationary bicycling, 20 to 30 minutes at a time every day, that would help.
Okay. Dr. Ben, thank you
Yes.
so much. I have one question
Okay, Ms. Lee.
to ask. You are also doctor, but why always the doctor stop the patient to take supplement? Every doctor, because my friend always tell me, my doctor asked me to stop all the supplement increase the Celergen. So I say, but what you think? No, I never listen. I continue. But why the doctor? Even the doctor not understand what is the Celergen, but they stop them.
Okay. Very good question. If you had met me 30 years ago, I would be the same doctor as those doctors, because we were trained in med school that supplements are not necessary. All you have to do is eat a well-balanced diet. But like I said, all these decades of my practice, I now believe that there's no such thing as a well-balanced diet. Ergo, a term we use in logic. Ergo, you need to supplement your diet with substances, micronutrients in particular, that would help it function well and repair itself. So we were trained not to give supplements. We were trained to give medicines. That is why most doctors, until now, even doctors older than me, there are those who believe we don't need supplements because we were trained not to recommend supplements on the basic fact that all you need to do is eat a well-balanced diet. But that basic fact has been negated repeatedly. And I'm happy for your patient. He did not listen to your doctor.
Thank you, Dr. Ben.